What we found in going through the EHR implementation was that everybody had their own way of managing images. There were a number of different silos. Cardiology had their silo, radiology had their silo, and then there were smaller silos in ophthalmology and obstetrics, dermatology, pathology. Everybody had their own way. And bringing everybody to the same table so that we could say there's going to be one way we at Duke University Medical Center and across Duke Health System are going to be able to manage images. This is how we're going to do it. Bringing everybody together was a very valuable conversation, and it's ongoing. It's something we're still struggling with today because everybody has something specific that they're looking for. Working with TeraMedica has been great because they've been fairly open and fairly good to work with us to try to accommodate the different workflows and the needs of the different areas that are out there. The ability to consolidate all of the different silos that capture images and manage and store those images today. One of the very easy ways that you can save money is put in an archive platform that is going to be around for a long time, get everybody using that platform. You don't have to deal with some of the interface maintenance. You don't have to deal with some of the storage costs that are very nickel and dime across all the different silos in a health system. You get a bunch of clinical leaders together and you're able to have very straightforward and functional conversations about patient care. And when you do that, you open up lines of communication. So as you're redefining how the OR is going to work and how clinics are going to work, you can redefine how images are going to be managed. And when you do that, all of a sudden, you've handled not only the IT aspects of taking care of the way patient data is going to be managed and patient data is going to be entered, whether it's text data or image data, but you also can now have very smart conversations about, well, is that how we should be doing it? Should we be managing population health and disease health that way? And you open up that line of communication across an electronic health record implementation or a VNA implementation, and you develop a very cohesive leadership team around that functionality. So it's been very, very helpful to do this alongside our EHR implementation because the same people who are developing the EHR and governing the EHR development process are in many cases the same people who are leaders managing the VNA process and managing the way population health and disease health should be done.